Foods for people with kidney disease. Kidney disease is a common problem affecting about 10% of the world population. The kidneys are small but powerful, bean-shaped organs that perform many important functions. They are responsible for filtering waste products, releasing hormones that regulate blood pressure, balancing fluids in the body, producing urine, and many other essential tasks. There are several ways in which these vital organs can become damaged. Diabetes and high blood pressure are the most common risk factors for kidney disease. However, obesity, smoking, genetics, gender, and age can also increase the risk. Uncontrolled blood sugar and high blood pressure cause damage to blood vessels in the kidneys, reducing their ability to function optimally. When the kidneys are not working properly, waste builds up in the blood, including waste products from food. Therefore, it's necessary for people with kidney disease to follow a special diet. Diet and kidney disease. Dietary restrictions vary depending on the level of kidney damage. For example, people in the early stages of kidney disease have different restrictions than those with kidney failure, also known as end-stage renal disease, ESRD, end-stage renal disease. If you have kidney disease, your healthcare provider will determine the best diet for your needs. For most people with advanced kidney disease, it is important to follow a kidney-friendly diet that helps decrease the amount of waste in the blood. This diet is often referred to as a renal diet. It helps boost kidney function while preventing further damage. While dietary restrictions vary, it is commonly recommended that all people with kidney disease restrict the following nutrients. Sodium. Sodium is found in many foods and a major component of table salt. Damaged kidney cannot filter out excess sodium, causing its blood level to rise. It's often recommended to limit sodium intake to less than 2000 mg per day. Potassium. Potassium plays many critical roles in the body, but those with kidney disease need to limit potassium to avoid dangerously high levels in blood. It's usually recommended to limit potassium to less than 2000 mg per day. Phosphorus. Damaged kidney cannot remove excess phosphorus, a mineral in many foods. High levels can cause damage to the body, so dietary phosphorus is restricted to less than 800 to 1000 mg per day in most patients. Protein is another nutrient that people with kidney disease may need to limit, as damaged kidneys cannot clear out waste products from protein metabolism. However, those with end-stage renal disease undergoing dialysis, a treatment that filters and cleans the blood, have greater protein needs. Each person with kidney disease is different, which is why it is important to talk to your healthcare provider about your individual dietary needs. Luckily, many delicious and healthy options are low in phosphorus, potassium, and sodium. Here are some of the best foods for people with kidney disease. Number 1. Cauliflower. Cauliflower is a nutritious vegetable that's a good source of many nutrients including vitamin C, vitamin K, and B vitamin folate. It is also full of anti-inflammatory compounds like indoles and is an excellent source of fiber. Plus, mashed cauliflower can be used in place of potatoes for a low potassium side dish. Blueberries. Blueberries are packed with nutrients and one of the best sources of antioxidants you can eat. In particular, these sweet berries contain antioxidants called anthocyanins, which may protect against heart disease, certain cancers, cognitive decline, and diabetes. They also make a fantastic addition to kidney-friendly diet as they are low in sodium, potassium, and phosphorus. Sea bass. Sea bass is a high-quality protein that contains incredibly healthy fats called omega-3s, which reduce inflammation and may help reduce the risk of cognitive decline, depression, and anxiety. While all fish are high in phosphorus, sea bass contains lower amounts than other seafoods. However, it is important to consume small amounts to keep your phosphorus levels in check. Red grapes. Red grapes are not only delicious but also deliver a ton of nutrition in a small package. They are rich in vitamin C and contains antioxidants called flavonoids. which have been shown to reduce inflammation. Additionally, red grapes are high in a resveratrol, a type of flavonoid that has been shown to benefit heart health and protect against diabetes and cognitive decline. These sweet fruits are kidney friendly. Egg whites. Although egg yolks are very nutritious, they contain high amount of phosphorus, making egg whites a better choice for people following a renal diet. Egg whites provide a high quality, kidney friendly source of protein. Plus, they are an excellent choice for people undergoing dialysis treatment who have higher protein needs but need to limit the phosphorus. Garlic. People with kidney problems are advised to limit the amount of sodium in their diet, including added salt. Garlic provides a delicious alternate to salt, adding flavor to the dishes while providing nutritional benefits. It's a good source of manganese, vitamin C, and vitamin B6 and contains sulfur compounds that have anti-inflammatory properties. Buckwheat. Many whole grains tend to be high in phosphorus, but buckwheat is a healthy exception. Buckwheat is highly nutritious, providing a good amount of B vitamins, magnesium, iron, and fiber. It's also a gluten-free grain, making buckwheat a good choice for people with celiac disease or gluten intolerance. Olive oil. Olive oil is a healthy source of fat and phosphorus free, making it a great option for people with kidney disease. Frequently, people with advanced kidney disease have trouble keeping weight on, making healthy, high-calorie foods like olive oil important. Majority of the fat in olive oil is a monounsaturated fat called oleic acid, which has anti-inflammatory properties. What's more, monounsaturated fats are stable at high temperatures, making olive oil a healthy choice for cooking. Bulgur. Bulgur is a whole grain wheat product that makes a terrific kidney-friendly alternative to other whole grains that are high in phosphorus and potassium. This nutritious grain is a good source of B vitamins, magnesium, iron, and manganese. It's also an excellent source of plant-based protein and full of dietary fiber, which is important for digestive health. Cabbage. Cabbage belongs to the cruciferous vegetable family and is loaded with vitamins, minerals, and powerful plant compounds. It's a great source of vitamin K, vitamin C, and many B vitamins. Furthermore, it provides insoluble fiber, a type of fiber that keeps your digestive system healthy by promoting regular bowel movements and adding bulk to the stool. Plus, it's low in potassium, phosphorus, and sodium. Skinless chicken. Although a limited protein intake is necessary for some people with kidney issue, providing a body with an adequate amount of high quality protein is vital for the health. Skinless chicken breast contains less phosphorus, potassium, and sodium than skin on chicken. When shopping for chicken, choose fresh chicken and avoid pre-made roasted chicken as it contains large amount of sodium and phosphorus. Bell peppers. Bell peppers contain an impressive amount of nutrients but are low in potassium, unlike many other vegetables. These brightly colored peppers are loaded with powerful antioxidant vitamin C. In fact, one small red bell pepper contains 105% of the recommended intake of vitamin C. They are also loaded with vitamin A, an important nutrient for immune function which is often compromised in people with kidney disease. Onions. Onions are excellent for providing sodium-free flavor to renal diet dishes. Reducing salt intake can be challenging, making finding flavorful salt alternatives a must. Sauteing onions with garlic and olive oil adds flavor to dishes without compromising your kidney health. What's more, onions are high in vitamin C, manganese, and B vitamins and contain prebiotic fibers that help keep your digestive system healthy by feeding beneficial gut bacteria. Arugula. Many healthy greens like spinach and kale are high in potassium and difficult to fit into the renal diet. However, arugula is a nutrient-dense green that is low in potassium, making it a good choice for kidney-friendly salads and side dishes. Arugula is a good source of vitamin K and the minerals manganese and calcium, all of which are important for bone health. This nutritious green also contains nitrates, which have been shown to lower blood pressure, an important benefit for those with kidney disease. Macadamia nuts. Most nuts are high in phosphorus and not recommended for those following a renal diet. However, macadamia nuts are a delicious option for people with kidney problem. They are much lower in phosphorus than popular nuts like peanuts and almonds. They are also packed with healthy fats, B vitamins, magnesium, copper, iron, manganese. And now radish. Radishes are crunchy vegetables that make a healthy addition to renal diet. This is because they are very low in potassium and phosphorus but high in many other important nutrients. Radishes are a great source of vitamin C, an important antioxidant that has been shown to decrease the risk of heart disease and cataracts. Additionally, their peppery taste make a powerful addition to low sodium dishes. Turnips. Turnips are kidney friendly and make an excellent replacement for vegetables that are higher in potassium like potatoes and winter squash. These root vegetables are loaded with fiber and vitamin C. They are also a decent source of vitamin B6 and manganese. They can be roasted or boiled and mashed for a healthy side dish that works well for a renal diet. Pineapple. Many tropical fruits like oranges, bananas and kiwis are high in potassium. Fortunately, pineapple makes a sweet, low potassium alternative for those with kidney problems. Plus, pineapple is rich in fiber, manganese, vitamin C and bromelain, an enzyme that helps reduce inflammation. Cranberries. Cranberries benefit both the urinary tract and kidneys. These tiny tart fruits contain phytonutrients called A-type proanthocyanins which prevent bacteria from sticking to the lining of the urinary tract and bladder, thus preventing infection. This is helpful for those with kidney disease as they have an increased risk of urinary tract infections. Cranberries can be eaten dried, cooked, fresh, or as a juice. They are very low in potassium, phosphorus, and sodium. Shiitake mushrooms. Shiitake mushrooms are a savory ingredients that can be used as a plant-based meat substitute for those on a renal diet who need to limit protein. They are an excellent source of B vitamins, copper, manganese, and selenium. In addition, they provide a good amount of plant-based protein and dietary fiber. Shiitake mushrooms are lower in potassium than portobello and white button mushrooms, making them a smart choice for those following a renal diet. The bottom line: kidney-friendly foods above are excellent choices for people following a renal diet. Remember to always discuss your food choices with your healthcare provider to ensure that you are following the best diet for your individual needs. Dietary restrictions vary depending on the type and level of kidney damage, as well as medical interventions in place such as medications or dialysis treatment. While following a renal diet can feel restrictive at times, there are plenty of delicious foods that fit into the healthy, well-balanced, kidney-friendly meal plan.